when did the psychiatric field of medicine switch
Oh,
from calling this gender dysphoria, like
mhm.
an
Yes.
issue, to actually acknowledging it as just what is it now? What it's because it's not
Yeah.
considered a problem anymore.
Well, it's a bit complicated, but I mean, the dirty little secret is that the so-called Diagnostic and Statistical Manual of the American Psychiatric Association. People, that sounds really fancy, like it's this sort of encyclopedia of all the diseases that psychiatrists have discovered. Not really. It's more accurate to think of it as the billing code that psychiatrists need in order to get paid for insurance. And so you need a
Mm.
distinct diagnosis. And because of that, because it's not sort of the manual of the things we've discovered, like, a need for an open heart surgery or breast cancer, or, definable things. It's very subject to politics and to ideology. So prior to 2013, there was a diagnosis called gender identity disorder, which is actually kind of self-explanatory. It's basically, if, say, a boy was confused and thought he was a girl, then it's a disorder because he's confused about who he actually is. And so that would be the disorder. So if that's the disorder, well, of course, the way to help him, if he's a boy, would be through presumably therapy to try to get him comfortable with who he actually is. But the APA talked explicitly to sort of gender ideologues and gender activist organizations because they were sort of thinking, okay, maybe this is insensitive. And so they literally got suggestions from the ideologues on the other side about what this should be. And so in 2013, still it's in the DSM-5, they took out gender identity disorder and they put in something called gender dysphoria. And gender dysphoria just means basically severe discomfort with your gender. And there's this kind of backstory here, but the way they would define it is when you feel psychological distress at your sex, between your sex assigned at birth, right? So sex is gone. It's just the thing the doctor imposes on you, and your so-called gender identity. Okay. Now, so if what you really are is just this idea, this idea of yourself in your head called a gender identity, and sex is nothing more than kind of an imposition that a doctor assigns to you. Well, then how do you fix that? How do you fix the discomfort between these two things? Well, now the way to fix it is just to relieve the discomfort. And if what you really are is this sort of disembodied gender self, then the proper therapy would be so-called gender affirming care, where you change the body, you change the pronouns, you change the social surroundings, you literally remove body parts to get the body to conform to this internal sense of gender. That's how people can, with a straight face, refer to these ghoulish experiments, frankly, and interventions as something called gender affirming care. It's basically saying, okay, the main thing that you are is this sense of yourself inside yourself. So the way we fix it is, if necessary, we remove body parts and we refashion this meat suit that's not really who you are. I mean, that's what's behind this. So strangely, a change of terms in the DSM-5 essentially summarizes this sort of takeover of the psychiatric profession and other medical professions of the categories of gender ideology. I mean, I don't know how to emphasize this enough, that medical organizations historically, I could give you multiple examples in the 20th century, get captured by ideologies. And so their guidelines and their practices that they advise are determined not by the best science, they're determined by ideology. This is just an obvious current example of that. If it was a century ago, it would have been eugenics. But for a lot of normal people that trust doctors and medical organizations, hard to get your mind around the idea that the American Academy of Pediatrics could get taken over by a bunch of crazy ideologues, except that that's exactly what's happened.
It's
That's
exactly
so
what's
crazy.
happened, and it's exactly what always happens.
Mhm.
This is absolutely nothing new. Activists are always hijacking the psychiatric profession. Multiple personality disorder
Mhm.
is completely debunked. It doesn't exist. There's no such thing as multiple personalities. We saw just this week, they're now acknowledging, oh, maybe we shouldn't have given hundreds of thousands of boys ADHD medications.
Mhm.
No, you shouldn't have. They were just
I didn't
boys
see
being
that.
boys. And they don't all have some disorder called ADHD just because they don't want to sit at a desk for 7 hours a day. That's a very unnatural human behavior for a small child, especially for some of these boys. I mean, they did lobotomies for decades. It finally ended. The last patient they did one on died. That never had
Oh my
any
God.
scientific credentials to it. But you had these extremely distressed people, some of whom now, after cutting away at the fibers of their prefrontal cortex, appeared to be calmer. and it was hailed as this miracle cure, and it was popularized by the media, just as this has been popularized by the media. And these activists want to have it both ways. They want to say this isn't a disorder at all now, because this is just someone's natural identity. Well, if it's not a disorder, the next step and what's happening is, well, you shouldn't even get therapy for these kids before you do the so-called gender affirming care, which is really sex denying harm, which is what it
Mm.
is. But now the trend is, well, you shouldn't even suggest therapy, because to suggest therapy is to say that there is something wrong with their gender identity. Well,
Yeah,
gender
but
identity is all nonsense.
it is, but it is. Chris said they want it both ways. They still want insurance to cover the procedures,
Right,
though, and so it needs to be considered a disorder for that purpose.
right.
But the other side we shouldn't treat as a disorder. So